What do you need to know about non-alcoholic fatty liver disease and how you can treat it? Now, it's important to know what this condition is and that it's not related to alcohol consumption. So now, before we just get started though, I just ask if you haven't already, make sure you hit that subscribe button and click the little notification bell so you never miss when I release a new video or when I go live. And when you click the notification bell, select all so you are notified of all videos. Now, years ago, non-alcoholic fatty liver disease didn't exist because anyone that had fatty liver had it from excess alcohol consumption, as would be obvious from an alcoholic fatty liver disease, but in this case, it's non-alcoholic fatty liver disease. But in the last century, this has started showing up in non-alcoholic drinkers, and surprisingly enough, it's even showing up in teenagers and kids, which is baffling to the mind. Now, the non-alcoholic causes of liver disease are actually more common now than the alcoholic one. So the main underlying cause of this condition is consuming too much energy, particularly carbohydrate energy. So basically energy excess and weight gain is basically the cause. So the standard American diet or the standard Western diet, however you want to refer to it, of basically high carb, high fat, high processed food, and high refined sugars. That is the number one cause. So as the name of this disease suggests, it's an infiltration of fat within the liver. So it's basically an accumulation of fat within the liver. But as you'll see in a minute, and as we just basically referred to, it's not a relation to consuming too much fat. It's mainly an overconsumption of energy in the form of carbohydrates. So here's the biggest problem. It can basically progress to a condition called NASH, N-A-S-H, which is non-alcoholic steatohepatitis, or even cirrhosis, which is end-stage irreversible liver disease. Now that's a big problem. Now it's thought that this disease, this non-alcoholic fatty liver disease, also known as NAFLD, is going to be the number one cause of liver transplants over hepatitis, over liver cancers, and over alcoholic fatty liver disease. It basically just shows the how prevalent it is becoming in our society, as society is becoming more and more insulin resistant, metabolically dysfunctional, obese, and everything that goes along with energy excess, specifically refined carbohydrate and sugar excess. So now, how do you treat this condition? So basically, as I've kind of already referred to, you basically treat it by removing the offending agent, which is energy excess. So too much sugar and refined carbohydrates, as well as excess fructose consumption. So you can remove those things, you're well on your way to reversing it or just preventing it. So it's no surprise that studies have shown that low carb and keto diets are very effective at treating NAFLD, again also known as non-alcoholic fatty liver disease. And in fact, there is a 12-week trial showing a Mediterranean-style keto diet, and in those 12 weeks, they showed that complete normalization of fatty liver. Now, I'd say that's pretty quick if you ask me. 12 weeks to go from having fatty liver symptoms to having it normalized and resolved. Now, your doctor can diagnose NAFLD by liver function blood tests or through imaging such as ultrasound or an MRI. Now, this 12-week study that I just referenced shows that this is something we can address and is a big problem for those that have it. So it's something that's treatable. It's not an irreversible condition. And what's empowering is that if you have this or are in the preliminary stages of it, like I just said, it's irreversible. It's reversible, not irreversible. It's reversible. So it's not a death sentence, but you do need to make the changes. You need to decrease the excessive energy consumption, particularly refined sugars, processed carbohydrates, and excess fructose consumption. Now, since this is a serious medical condition, and if you're going to treat it with a nutritional intervention, as mentioned in the study above, please make sure you do this under the guidance of a medical professional or a healthcare provider, okay? Just please don't try to do this on your own, as there is some complications that can arise from attempting to do this without having the proper supervision and attention. So if you need help, I can help you in person or online, or I can refer you to someone as well. Also, a great resource for finding a medical professional in your area that understands low carb and keto diets can be found at dietdoctor.com. So yeah, so if you live in an area that you can't find somebody in person or whatever reason, you're not at a loss, because there's people all over the world, medical professionals, healthcare providers, people like myself, that'd be more than willing to help someone through distance coaching, distance health, whatever you want to call it. So you don't need to be locally in that place. You can just do it virtually. So I really hope that this was helpful on basically what NAFLD is, what the causes are, how to treat it, and what can be done. Now, if you know of anyone that may benefit from this, please consider sharing it anywhere on social media, as you may help them resolve their health issues, or even at a minimum, just drastically improve them. And you know what? As I always say, I really appreciate you watching my videos. Thanks for taking the time to get to the end of it here. And please remember to subscribe and click the notification bell and select all. And as always, if you have ideas for future videos, make sure you comment below, as this helps me know what videos to create and what you'd like to learn. So keep it locked in here on my channel, and I look forward to coming to you in the next video.